Have you been prescribed prednisone for asthma? Hi, I'm Dr. Megan, the prednisone pharmacist. I'm here to tell you all that you need to know about taking prednisone for asthma and other inflammatory airway diseases. So, I have family members and I have a personal history of sometimes having asthma symptoms. And so, in addition to that, I am a doctor of pharmacy and I did a rotation at the pulmonary clinic while I was in pharmacy school. So, I got specialized training on asthma from the best expert in the state. And so not only do I have personal experience, but I've gotten the best training you can possibly get as a pharmacist about this. So, prednisone for asthma, why would you need it? What is it for? Actually, let's start with what is asthma? Asthma is a reactive airway disease where the lungs are having trouble breathing because the little tiny parts of the lungs in the big branch of the tree are swollen and are not letting as much oxygen in. And so it feels like you can't breathe as well, and you might cough, you might wheeze, and feel miserable. So right now I am dealing with an infection personally, and I at the urgent care clinic they gave me a nebulizer with dexamethasone in it. And so dexamethasone is like prednisone. And so I'm personally dealing with this right now. So I thought it was a great time to record this video because I've been wheezing and having to use my Symbicort inhaler often, and it's not been fun. So Symbicort and other inhalers are like prednisone because they have a steroid in them. So what's important to understand is that prednisone is a steroid. It's an anti-inflammatory, and it's helping to open up the lungs by lowering the inflammation. And so prednisone is a pill you can take. So it's going to come in a bottle like this, or your doctor could prescribe something like methylprednisolone. These are different options. They could also prescribe dexamethasone, or they could prescribe hydrocortisone. There's a lot of steroids that are pills that they could prescribe. They could give you an IV of steroids. And then they gave me the nebulizer version of steroids where I was breathing it in, doing a breathing treatment. Or you can use an inhaler version of steroids. They're all steroids and they're all working in the same way. The big difference is how fast they're working and how much is being affected by them. So when you're using the inhaler, that's the best because it's going straight to the lungs and it's having a minimal effect on the rest of your body. Whereas if you take the pill, it's not just affecting your lungs, it's affecting everything. It affects your eyes. It can give you blurry eyes. It can give you cataracts and glaucoma. It's affecting your bones. It can cause osteoporosis. It's affecting your muscles, which can cause muscle loss. It's affecting your heart. It can cause arrhythmias and like rhythm changes and actually fatal complications to your heart. It is affecting your immune system, causing a decrease in your immune system, leading to increase in infections, and you can be more likely to die of things like pneumonia. It's affecting sleep and causing insomnia. I hated when I had to personally take prednisone for my autoimmune disease, which is not asthma. And I had the hardest time sleeping, and it's affecting your mood. It can cause mood changes and emotional roller coasters and on, up to 150 different side effects. And so it's best if those side effects are kept to the minimum by using an inhaler or a nebulizer to get it straight to your lungs. One of the side effects that's unique to asthma and other breathing things for people who take prednisone. Now, I talk to people who take prednisone for a lot of conditions. Prednisone's weird like that. Prednisone can be used for a lot of conditions. Things like this, it's only for breathing, right? Whereas prednisone can be used for like eye issues, brain issues, heart issues, skin issues. It can be used for tons of different things. But when it's used for asthma, specifically inhalers, because it's depositing the steroid in your mouth and in the back of your throat, it can increase your risk for what's called thrush or a fungal infection in your mouth. And you'll know you have it if it's like you're having these painful like plaques or like lesions in your mouth and they're white. That means you might have a fungal growth, like an infection from a fungus in your mouth. And it's not fun, and the treatment isn't easy. It doesn't go away instantly. So the best thing to do is if you have to take this, to rinse your mouth out every time you use a steroid inhaler. and every time you use your nebulizer, if it has the steroid in it too. So prednisone works really well and it works pretty quickly. So what dose would you take? So if you have tried everything, you've used your inhaler, you've used your nebulizer and albuterol and all of the things to the maximum dose, then you might need prednisone or another steroid. And the dose you might need is somewhere between 20 to 60 milligrams a day, and you'll often use it for 5 to 10 days. And this is prednisone 20 milligrams, and it's technically a high dose. Below 10 milligrams is considered a low dose. Between 10 and 20 is like a medium dose. And so taking 20 to 60 milligrams is a lot of steroid. But if you're having a hard time breathing, then that makes sense. Even though you're having all these side effects, those benefits are going to outweigh the risks for you if you're truly having a hard time breathing. But if you're not having a hard time breathing, or if there's something else you could do to make your asthma better, then the benefits don't outweigh the risks. So I'd like to share a few things that can help with asthma care to make it so that the treatments you're using are working better to their maximum benefit, so you don't have to resort to prednisone, because nobody wants to have to take prednisone if at all possible. If you just have a good old plain old albuterol inhaler, and that's the only thing you're using, and you go straight from albuterol to prednisone, there's a lot of steps in between you could take instead. And if you're going to use your albuterol inhaler, there is a really important technique you need to use. And it's really hard to get it right. In fact, every time we saw a patient in the pulmonary clinic, we asked them to show us how they use their inhaler. Every single time, even for people who've been on it for years and years and years, because we can get into bad habits. We can forget the proper technique. And so every inhaler is different. So this one is a metered dose inhaler. So it's got like a piece here and then the spray comes out here. But then this one, it's different. It pops out and it's a dry powdered inhaler. And so you pop it out and you don't squirt anything. You just suck really hard and hold it in. And so all of them are different. All of the inhalers are different. And so you need to know exactly how to use your inhaler. And I recommend going on YouTube and looking at the manufacturer's instructions for your inhaler and exactly how they recommend using it, because it might be different. But if you use it just like this and go, that's not the most effective, because this kind of inhaler can come out at 100 miles per hour, like what's being pushed out. And if you're not completely coordinated, you might lose all of that, and it might just land on your tongue, the top of your mouth, and the back of your throat. And it never even gets to your lungs at all. And so we want to do whatever we can to get those little tiny particles from the inhaler all the way down to the bottom of your lungs where you're having the breathing problem. And that requires a lot of coordination. And if you're not coordinated, and I'm not that coordinated, then you should use one of these. It can look like this. It can look like this. They're called spacer. And for this one, you put it over, it goes over your nose and mouth, and you attach the inhaler on that end, and make sure you shake the amount of time it says on the label from the manufacturer, and you press it down while breathing in, not really hard, but like steady. What's really cool about this spacer is it has this little white thing right here. It's like a whistle. And if you're breathing too fast, it whistles. And so it like warns you, don't breathe that fast. It needs to be steady and like deliberate and like kind of fast, but not like, it needs to be drawn out so that it gets deep into your lungs. The other thing about this one, my professor recommended, is it's cool. You can actually store your inhaler in it for traveling. So this is my travel one. So that's the first thing, is watch exactly how your manufacturer recommends to do it. Then use a spacer. And then third, take all of this to the pharmacy and ask the pharmacist to watch you doing it and see if they have any suggestions for how you're doing it and if you could do it better. Because even the best of us can get it wrong, and it's okay. It's important so that you breathe. It doesn't matter. Like, there's no competition here. This is all about your health. And so just be teachable and let people help you, because even I have had bad technique before, and I know family members who have terrible technique, and I really try to teach them, and it's hard. So be sure to get the proper technique, okay? And then be sure that you're using the right thing at the right time. So this one is plain albuterol. And then this is a combination of something that's like albuterol. It's salmeterol. Do you hear the "erol" in there? And fluticasone. So it's a combination. Same with this one, budesonide and formoterol. They're a combination. There are two ingredients in there. The one that ends in "anide" is just like prednisone. It's a steroid. They're the same thing. And then the oterol part is just like albuterol, formoterol, albuterol, and salmeterol. They're all beta agonists. The only difference is how long it takes them to work. And recently they've discovered that this combination is the very, very best. The brand name is Symbicort and the generic name is budesonide and formoterol. The combination of how quickly these steroid and the beta agonists work to help you breathe is the very best for saving people's lives with asthma. So if you are given something like this, then ask if you can get something like this. And then, are you using only albuterol or are you using this? Because the budesonide part of this can help prevent wheezing. Whereas if all you're using is straight up albuterol, all it does is treat the symptom. It doesn't prevent the wheezing from happening. And so you'd want to use the albuterol when you're having a hard time breathing after you've already used this. But if you know you're going to use both, here's a little quick hack. Use this one first to help open up your lungs so that you can absorb more of this. Cool, huh? And then other things that you can do to improve your asthma. So if it's allergic asthma, minimizing your exposure to whatever you're allergic to. If you're allergic to a dog, maybe making sure your dog's not allowed in your bedroom so that when you sleep at night, that the dog is out of there, or finding a new home for your pet. I know that's the hardest thing in the world. My kids would be devastated if we had to find a new home for our pets. And then having a healthy lifestyle, quitting smoking is really important. If you don't smoke, but other people around you do, maybe finding a new place where there aren't smokers. I had a cousin who had to do that. And then certain supplements can help improve asthma, such as vitamin D and omega-3 vitamins, omega-3 fatty acid, like fish oil supplements. And then getting good sleep. I know it's so hard to sleep when you have asthma flaring because you're having a hard time breathing. And so you might be coughing all night long or just wheezing all night long. But stay in close contact with your doctor so that you can get as much sleep as you possibly can. And work really closely with your doctor so that you can get your symptoms under control. And your pharmacist is also there to help. I always loved helping my patients at the pharmacy, showing them exactly how to use all of these cool tools because they're obligated by law to offer to teach you about this, is obligated to counsel. Whether or not you take them up on it is a different story. So I invite you to take them up on it and learn all you can about your condition. And then if you're wondering, okay, I have to take prednisone. I've done everything you said, Dr. Megan, and I feel awful. I have to take the prednisone or the Medrol dose pack, and I have no other option. Was there anything I can do better? Yes, there are ways to counteract the side effects of prednisone, even if it's just short-term like this. And that's exactly why I created the prednisone checklist. So having personally taken prednisone, I wanted to know exactly what I needed to do to counteract or prevent the side effects of prednisone. And so I detail that all in the prednisone checklist. Plus, I include the top 7 mistakes people often make while taking prednisone and exactly what you need to do to avoid them. So just click the link below to download the prednisone checklist now, and then you'll know exactly how to have the best experience you possibly can while taking prednisone. Signing off as Dr. Megan, your prednisone pharmacist.